I usually don't do videos like this, but something happened to me a couple of days ago that sort of made me marvel a little bit, and I thought I should document it. I've been struggling with lower back and hip pain for a couple of months already. Um, it wasn't hideously bad, but I couldn't walk without feeling as if there was sand in my hip joints. I felt as if things were grating there. I couldn't twist my hips without pain. I couldn't bend down. So a couple of weeks ago, at the start of April or something, mid-April or so, I decided to go for physical therapy before it got worse, basically. I just finished about a week of vacation in Penang, and it was such a bad experience because I just couldn't sleep on any bed without hurting, and walking around was not fun, and standing. So I decided, okay, I better do something before it gets too bad. When I went to physical therapy, I wasn't awful yet. Um, the first session was nice and everything, but for some reason, the following weeks, I just got spikes of times where I was really, really bad to the point where I couldn't sleep at night because it hurt to sleep on my bed, on my really, really expensive latex mattress, which I did not have a problem with before. A couple of days ago, things got so bad. The pain was so bad because by that time, I couldn't walk, sit, stand, move around without pain. I felt as if I just couldn't get any respite from the pain no matter what I did, not even when I'm lying on bed, on the bed, in the bed with the proper pillows cushioning you to prevent pain. I couldn't get any relief. I think around 3 a.m. or so, I sort of like woke up and I cried to God. I'm a religious person, sort of. I'm a Christian, so I believe in Jesus. And I just cried out to him and said that, look, I can't do this anymore. I need your help. I need supernatural intervention because I've done everything to fix myself and I just couldn't fix myself. And I cried. And for some reason, I was scrolling YouTube just to occupy my mind at the time. And I came across a video by a lady who spoke about Dr. John Sarno, was it Sarno? Um, she was telling her viewers that after reading the book, she just got better. And the book was called Healing Back Pain, Healing the Back. But anyway, the proper title is in the description. But the thing is, I remember that book. I bought that book many, many years ago. Um, I tend to get shoulder pain, very rarely back pain. Okay, I always get neck and shoulder pain. And there was one time around 2010 or 2008, I think it's 2008, where it got so bad. I needed PT desperately. It got so bad that my muscles around my neck was like rock. If you touch it, it felt like the surface of like rock. It was really that bad, and I couldn't turn, I couldn't do anything, and I was just like fixed in this crazy position. The PT did ultrasound and things like that, but it didn't work. Nothing they did worked. And I think I ordered Dr. Sarno's book. I'm not sure why I ordered that book when it says healing back pain, but I ordered it, and I remember reading the entire book and thinking, that's it. I don't have to do any exercises. I just have to believe that it'll go away, and it will. I remember thinking, that's such a strange premise for a book. I actually thought that it was hokey, it was a joke or something like that. But something bizarre happened after I read the book. My shoulder pain disappeared. I remember that. I mean, at that time, I thought that it was because of how to say, I found a tennis ball and started rolling around my shoulder. It seemed to help. I thought that was the reason why the pain faded. But what struck me was after reading that book, it just poof went away. So I thought maybe it was just a mixture of several things. I didn't think much about it. After a while, I sort of I reflected on what the doctor said, about how emotional pain can cause back pain issues and stuff like that. And I realized the reason why, that time when I had that severe shoulder pain, that was almost a month after my beloved dog passed away. I really, really loved that pooch, like super loved it. And I'm the sort of person that will keep a strong front, even though I've gone through a horrible tragedy. If I'm in public or if I'm in office, I'll still put on a smile. And Dr. Sarno said that people like that tend to have a condition where the brain passes the stress onto the body. So you can get, shoulder pain, irritable bowel syndrome, back pain. After thinking about it, I realized, yeah, that was probably what happened to me. I was so stressed up by my dog's passing, and my family. Well, by nature, we are very stoic people. My parents actually told me to stop talking so much about my dog because it's not good to dwell. So my family, we have this philosophy of, well, if you've gone through this, what's the point of dwelling on it? What's the point of talking about it all the time? So I've learned to stuff my feelings. I always look very cheerful in the public, but inside I may be facing something and you wouldn't know because I'm always cheerful and joking, and that's the sort of person I am. I just don't feel like I should inflict my pain or my problems on the world. And that kind of covers my relationship with God too, to the point where I don't ask Him for help. So that night, coming back to the present, that night when I asked Him for help, it's like one of my desperate moments. You know that I'm super desperate if I ask God for help for anything. I know that's, as a Christian, we should be asking God for stuff and help all the time, but I'm the sort of person in my head is like, oh, I don't want to bother God about this small little issue. I can do this myself. No matter how many times I tell myself to ask God for help, to always rely on Him, I do this. So I that night I broke down finally and begged Him for help. And based on past experiences, I always know that He will help me. And I think He led me to that lady's video. The URL is in the description as well. So after watching the lady's video, I remembered Dr. Sarno's book. And yeah, so it wasn't hard to believe his message, because I've already gone through it. I've already experienced the healing effect, so to speak. So I immediately knew what to do. I knew that for some reason, the pain that I was having for the last few months was an accumulation of stresses. And I knew precisely what stress it was because I have a few difficult incidences in the last few months, not to mention the pandemic. And there was one specific problem or issue in my life that I actually said to myself, I'm not even going to write about it. I'm not even going to acknowledge it. I'm not even going to talk about it to myself because I don't want to even put words out into the world about this problem because that will make it real. So yeah, I didn't journal about this problem. I didn't talk to this problem. I did, try to speak to a therapist about it, but even then I couldn't bring myself to say anything. And I actually throughout the whole session laughed and smiled. And usual modus operandi, I'm stoic, I can handle it, So I never really let it out, so to speak. I never really discussed it because it was too painful. I didn't want to face it. I guess where would the pain go? It will go into my body. And so I cried, and I just started confessing and started talking to God about that problem that I didn't want to talk about, even to Him, even to myself. I told Him about it. Not just that problem, but another problem that I also didn't want to really write down and acknowledge. Two massive problems. Had a good cry, and I knew it was a different kind of cry because I felt really exhausted after that. I felt as if something big just poofed out of me finally. It was all stuck inside, finally it came out, and the effort of it coming out sort of like exhausted me. And the most bizarre thing happened. My pain went down by 60, 70%. I swear to you. It just went down 70%. I remember lying in the bed and thinking, did that just happen? My bed, which was so uncomfortable and painful to lie on, suddenly became like heaven. I was like, oh, I remember this latex mattress that I bought, this really expensive latex mattress that I bought that I really liked. And suddenly I remembered how wonderful it was again. The incident puzzled me so much because I realized how powerful our minds are. It's just so powerful that we can delude ourselves and we can do this to ourselves. And we do read that book. It's a really good book. I won't blame you if you don't believe it because the premise feels very unbelievable. Because for the first time when I read that book, I felt like, what is this guy talking about? For real, man? Like us Malaysians will say. But it's kind of true. And it's rather logical if you think about it. I think most doctors will admit or acknowledge at least that some problems like eczema, IBS, irritable bowel syndrome, um, things like that are caused by stress. I My entire life is filled with these stories. Okay, I tend to get eczema and stomach problems during moments in my life where I got a lot of stress. My it's funny because I always joke with people and say that my brain is very creative. If I'm stressed, I know I will get sick. It's just that I have no idea what sickness it will be because it's damn creative. Like there was one time I had a very stressful period in my life where I had to work late hours and prepare for a major professional exam. I broke out in hives in places that I don't want to even repeat, but basically it was very painful. Broke out in hives. It was not funny. And every doctor I went to, they said, oh, stress. Another period of my life, again, super stressed out to the gills. And my stomach just stopped processing food and I lost a ton of weight. And I knew it was stress, and things only changed after I left the job. So when it comes to psychosomatic disorders or illnesses, induced illnesses, I do not have a tough time believing that it's true. I know that it's real because I've gone through it all my life. It's just that this is the first time I realized that I can actually get back pain from that as well. I mean, it's logical, right? If your bowels and your shoulders and your skin gets affected by stress, why not your lower back? What and your hips? What's the difference? So I guess I made this video because maybe you're like me, you came across that lady's video and maybe you are looking for answers. So I just want to say that, well, try have a look at Dr. Sarno's books. He wrote more than one. Our mind is very powerful and sometimes it just inflicts pain on us. And his theory is very simple. It's like if you don't want to deal with your emotional pain, your brain will do something about it. And a lot of times it will bring up pain to distract you from the emotional pain because it prefers physical pain over emotional pain. At least that's his theory. My own little theory is that where will the stress go? It will go to your body. If you don't release it the proper way, your body will absorb it. Just where it absorbs it depends on your luck, I guess. I will still document my journey because I still have twinges here and there, but my God, my pain has gone down by 70, 80% almost. I will see how I go tonight. Oh yeah, another thing. I noticed that my pain tends to get worse when I sleep on that mattress. I'll be totally fine, like my back will be all right, right before bed. But the moment I lie in the bed, it just goes whack again. And I was like, why? Is it because my mattress sucks? So as I was watching a video by a guy who also recovered through doing this through Dr. Sarno's methods. I think they call it TMS method. And he was talking about how he used to have insomnia and stuff like that. And it was his way, his brain's way of distracting him from life's stresses or the emotional pain he wanted to avoid. Then it got me thinking, I have this bad habit of thinking about all the problems I don't want to talk about or think about when I'm in that bed. I'll be lying down in bed. Sometimes I'll talk to God and tell him about this, this problem, that problem. But the thing is, I won't ask him for help. I will just tell him that I'm so afraid about this. I'm so afraid about that. My life sucks or something like that. It's all just a litany of negativity and fear. I was expressing my fear rather than telling God, I know you will carry me through this. It's nothing positive about those moments at night in that bedroom in the darkness. I think my theory is, I think my body remembers that, oh, is that time again? She's going to say all these things, so let's distract her with major pain so she won't think about it. Isn't my brain creative? Well, at least that's my theory, because it makes sense, this is what I noticed. It is so bizarre. I'll be in pain throughout the night, especially when the sun sets and everything is dark. At the moment when the sun rises, when I see a bit of sun, suddenly my bed becomes super comfortable again. It's so bizarre. I remember I had it this morning. I had it the night before, the day before as well. I couldn't sleep as very well last night. I mean, much better than the last few nights and weeks. But the moment the sun started rising around 6:47, suddenly my bed became like, oh, this is so nice, so comfortable, and I could sleep in any position. Oh, so bizarre. I'm just saying that our mind is so powerful, it really can do all kinds of stuff. And I don't know, I mean, if you're struggling with back pain or any kind of joint disorder or some kind of migraine that's not explainable, doesn't have any major physical causes, like I'm not talking about like you got hit by a car and then you have back pain, not that kind of back pain, it's just like the back pain or the sudden migraine that came out of nowhere for absolutely no reason. You didn't do anything. I think one lady even mentioned that, she was just that lady that I watched, the video. She was uh, taking out garbage bags and just doing this, and then she got a back pain. How could that actually throw your spine out, when you think about it logically? For me, my back pain was just came out of nowhere one day. It just started building up, building up, building up, and then it just became intolerable slowly and slowly. Um, the only thing I would say about Dr. Sarno's book that was controversial is that he kind of encourages you to stop PT and all that, because he said, oh, you must stop PT and just continue life as if you don't have any back pain. And that's very controversial, because his theory is that if you still go for physical therapy or for treatments and all that, it's like a crutch, and your body will still believe that, oh yeah, it's working. My tactic of distracting you with pain is working because you're still doing all these things. So you need to let go. So in that sense, it's pretty controversial. I cannot imagine being able to do that. I'm not sure if I could do that if my pain had not halved. If my pain was at 100% and I just, do what I'm doing as if I was all right, I'm not sure whether I could do that. So I suppose in a way that's why the medical world doesn't recognize his work as much. Do I think there's a valid reason for it? I think there's a valid point that he's making. And he does mention that this doesn't apply for everybody. There are some people who really needs medical intervention. Like like I said earlier, if you got hit by a truck or things like that, then yeah, and you had real physical impacts on your body, then yeah, you need medical intervention. But these are for people who despite the MRI scan showing that you have sleep disc or things like that, doesn't mean that it will cause your back problem anyway. It's a very long story, but basically, all those things, slip disc, and then vertebrae that's protruding, whatever, I can't remember what's the proper term, but lumbar, well, all those things are what he calls sort of like normal abnormalities. This is the result of aging, not a result of injury. So even if someone shows you an MRI scan full of like slip disc and stuff like that, that slip disc may not cause you the pain. Another characteristic of this, give me a second while I look it up, the proper name for this. Right, according to Google, it's called Tension Myositis Syndrome. Right, so there are a few unique characteristics for Tension Myositis Syndrome. Is that the pain can shift around. Okay, so that's what I noticed about myself, that my pain actually shifted around. It's bizarre. Like I remember telling the PT, like, how is it that sometimes my pain is on the left side and sometimes it's on the right side? Today it's on the right side, but tomorrow it will be on the left side. And apparently is if you sort of like resolve the pain in one side, especially after a breakthrough like mine, where the pain just goes down 60%, 70%, do not be surprised if it appears anywhere else. And guess what? Right after this happened, where my pain just went down by 70%, I had bowel problems. Bowel problems is my body's favorite way of releasing the stress out, so to speak. So I wasn't surprised at all. Like hours later, suddenly I had stomach ache. Like, God, but instead of overreacting to it and getting very worried, I said, I know, you're so used to inflicting stress on the body that you got to choose another organ now that you've discovered, that you can't do the hips anymore. So yeah, that's another thing. It tends to affect people with a certain personality type. They are type A personalities who want to do things perfectly and always wants to put on a good front for people. And they take care of other people first instead of themselves. Describes me to a T, like, and I'm that sort of person where I just don't like to talk about my problems with people. I always put a brave front and laugh about it, even though inside I'm crying. Even if I'm crying inside, I pretend as if I'm not really crying. I don't know, the levels of denial I can go through is quite surprising. Um, yeah, so that makes me very vulnerable to TMS. Well, I hope this video helps you. If you're on the fence or you're looking for a solution, I would say just check Dr. Sarno out. You got nothing to lose. He doesn't recommend expensive surgeries or medications or whatever. He just recommends you to believe that your mind is capable of, or your brain is capable of, well, transferring the stress to your body. You're not using some kind of mental magic to solve your problem. I think it is very much cognitive behavioral therapy in a way. I don't know, let's say cognitive behavioral therapy. I can't help but think, as I read through his book and listen to the people who actually resolve their pain through this method, that it reminds me of the author Carol Weeks, her book on anxiety. She is she has passed away, but her book on anxiety, let me look it up again, give me a second. Right, Claire Weeks. So The unique thing about Claire Weeks is that she believes that we shouldn't think too much about anxiety. There are a lot of our methods tend to emphasize the anxiety too much. Like you're encouraged to dwell on it. You're encouraged to give it more significance than it's worth. So her method is like, so you're anxious, so what? I know. I'm very oversimplifying it. So Dr. Sarno has the same approach with this kind of pain. But chronic pain is sort of like very difficult to ignore, isn't it? But the attitude is, oh, so you have a tweak, a pain on your back. So what? I'll still continue doing what I'm doing. Yeah, this flies against the advice of many physiotherapists and stuff. Most of them will tell you, don't walk as much, don't do this as much, don't lift weights, don't do that. So that's a part of me that's a bit conflicted. I can see how this could be dangerous for some people, especially if they don't fit the TMS profile, if they don't really have TMS. I don't know what makes you different from that. But if you don't really have TMS and you ignore doctors' advice, I don't know whether that's a good idea, you know what I mean? So that's why it's really, really important. And that's what Dr. Sarno says in his book, for you to really find out whether you have a physical cause for your back pain or not. Don't simply just go, okay, you know, that's me. Go and find out, do proper medical tests. And if you do have a physical reason for your back pain, do obey your doctors. But this group of people, the people who are prone to TMS, the brain has literally reduced blood flow to certain parts of your body just to distract you from your emotional pain. That's Dr. Sarno's theory. That's different in the sense that there is no actual damage being done. The brain is just making you hurt so that you forget stuff. Whereas if you have real physical damage, you cannot mind it away. You cannot use your brain to say, I don't want this pain anymore. So there. Okay, this is the most rambly video in the world, but I hope that I somehow helped.